Good morning. Plenty of encouraging news today. There was one new case of COVID-19 recorded in the Northern Territory in the last 24 hours, bringing the cluster to a total of 52 cases. The new case is a teenager from Binjari who was previously identified as a close contact and transferred to the Centre for National Resilience, where he tested positive. It is unlikely that he was infectious in the community. This shows us the hard lockdown is working and that caring for close contacts in quarantine is working. There continues to be positive wastewater in the Bicentennial Road catchment in Katherine, but this is where the children, the positive cases from yesterday, were living, and the signal strength is weaker, so we are pretty happy with that. The wastewater results for this catchment will be critical tomorrow. That will help us work out if we have truly trapped this. The Martin Place sub-catchment is positive, and we are working to explain that. There was no other positive wastewater in catchments where it wasn't expected, and Berrima has come back negative. The Rockhole wastewater is negative again, and all tests have come back negative. For this reason, Rockhole will transition from a hard lockdown back to an ordinary lockdown today at noon. That means residents in Rockhole are still in lockdown, but can leave home for one of the 5 reasons. Under no circumstances, are residents of Rockhole permitted to enter the Binjari community. There were 3,020 tests processed in the Territory in the 24 hours to midnight last night. There were 27 tests done in the housing block where the positive case from Binjari visited yesterday. I flagged yesterday that there could be more exposure sites because of this person. There is only one. It is a close contact site. It is the Shell Coles Express on the highway in town on Monday afternoon, the 23rd, between 4:50 p.m. and 5:05 p.m. In that 15-minute period, there were only 2 check-ins, but CCTV shows there were more people there at the time. We have located and isolated many of those through our investigation on the positive case, but if you went to this survey on Monday, Arvo, and did not check in, you are a close contact. You are required to contact us, get tested and isolate for 14 days. And no matter where you are in the Territory, check in, check in, check in. We have had positive cases spending days in the community because they didn't check in. Not checking in slows down the contact traces, which slows down our efforts to trap and trace the virus, which potentially slows down the transition out of lockdown. Don't think because you're just popping in and out that you don't need to check in. You do. You make the job harder when you don't. I know we ask a lot of hard things of you in times like these, but let's all agree that checking in is really the easiest thing we are asking you to do. There is one other exposure site that is being upgraded from casual to close. It is the Salvo's Op Shop on Saturday the 13th of November between 10:30am to 10:50am. There are only 2 days left in the replication cycle for this site, but we now have evidence that more than one positive case was there at the same time. So we need anyone at the Op Shop during that time period to get tested and stay isolated until a negative test returns. The close contact numbers now stand at 506. The rise in numbers is largely the close contacts of the woman who left Binjari while positive. 482 close contacts have been located and isolated. These contacts returned 453 negative results so far, so this is a good start to the day. Rockhole is our hard lockdown. We hope the wastewater tomorrow morning will help us plan the transition out of lockdown for Katherine into lockout. Finally, before I pass to Dr. Payne, I know we are all very aware of the huge amount of misinformation spreading online in the last few days. I don't really want to lean into the lies that are being spread, although given these press conferences generally get spliced up by international trolls. Hello to all the conspiracy theorists overseas watching this, please get a life. I don't want to go into their lies because that just gives them more oxygen and their lies are dangerous. So I'll just say a few things about this. I acknowledge local media for their informative and respectful coverage. Hard questions get asked without innocent, anxious people being demonised or deceived. I know there are ridiculous, untrue rumours about the ADF's involvement. As we all know, they aren't carrying weapons, they are carrying fresh food for people. And the ADF is just one small part of an absolutely extraordinary effort that is underway to care for our communities. I said the other day that a lot of NGOs are on the ground working round the clock. You deserve to know who they are. Worley, Kalano, NLC, Jarwin, Red Cross, Salvation Army, Mission Australia, Anglicare, Team Health, Catholic Care, St Vincent de Paul, Save the Children, Food Bank, Somerville. The staff at Woolies continue to go above and beyond. And a shout out to the businesses in Katherine who have been donating items even when they are being hit hard themselves. Just little things like that make sure all the staff, just little things like that, making sure all the staff working in the community have hats. You have been brilliant. Thank you, all of you, for helping people in Katherine and Binjari and Rockhole right now. I know they are grateful, we all are. There's obviously a lot of crap spreading about the Centre for National Resilience. As we all know, Howard Springs is the gold standard facility in Australia for COVID quarantine and care. Thousands and thousands of Australians have stayed there. Footy stars and rappers have stayed there. It's where our Olympians quarantined. It's Australia's best, which is why it's also used for our first Australians. So I urge people not to worry about the insane, unhinged stuff that's spreading online and that overwhelmingly comes from people who don't live here and know nothing about us. 99.99% of the BS that's flying around the internet about the territory is coming from flogs outside the territory, mostly America, Canada and the UK. People who have nothing better to do than make up lies about us because their own lives are so small and so sad. We don't need to pay any more attention to them. We don't need to listen to them. Listen instead to the powerful words of the traditional owners from yesterday. They said, "We are in lockdown because we are in the biggest fight of our lives. We are trying to keep safe. We are trying to do the right thing by the community and Katherine." You are doing the right thing. We are so, so grateful that you are, and we cannot wait to see you again on the other side of this. We all know what this is for. We are trying to protect the oldest continuous living culture on the planet. We have tens of thousands of years of history, law, custom and song to keep alive. And if anybody thinks that we are going to be distracted or intimidated by tinfoil hat wearing tossers sitting in their parents' basements in Florida, then you do not know us Territorians. Thank you.
Thank you, Chief Minister. Thank you, everyone. So I'll just comment on the situation briefly, and I'd like to give some acknowledgements and then turn to vaccination again. So we're in a situation now, it's clearly a positive day. We've got one new case in quarantine already, had been identified contact. What this demonstrates, and the series of results that we've seen over the last few days, being already in quarantine, an enormous effort to contact trace and identify people. And then with our widespread testing, we haven't picked any other people up who are outside of that, who have not been identified already as contacts. So I'd like to acknowledge now, we're not entirely through this campaign yet, but I just want to acknowledge the people that do this. And as we say, they do this right around the clock, 24 hours. These people have enormous levels of skill, they're highly trained, they're highly committed, but they care. The people who do this care deeply for what they're doing, for protecting these communities and for supporting them in the way that they've done. So I'd like to thank them again. I'll just say a bit about some of the people who are still in hospital. There are 2 remaining people in hospital, and one is due to be discharged today. So this is good news. We have been able to treat these people effectively. There does remain someone who is over 70 who is still requiring hospital care. On the wastewater testing, we will continue to monitor wastewater in Katherine and around Katherine and in other parts of the territory. It's proven to be useful as a surveillance mechanism, and it's helped us guide our investigation. And finally, I just want to turn to the issue of vaccination again. If you choose not to be vaccinating, you're choosing 3 things. 1, you're choosing to get the disease with your immune system being ill-prepared for that. That's the first thing. You're also choosing to be at greater risk to other people. So we need to protect others as well as ourselves. And also the third thing you're choosing is you're choosing to have a much higher likelihood of getting seriously ill and therefore requiring hospital care. Our hospital system has plenty of patients to treat already. Please get vaccinated. Thank you.
Good morning, everybody. Some positive information, which we're obviously pleased to see. We'll be aiming for that to continue, and we hope that the efforts of everybody get us closer to being able to make the move. So for the Rockall community, again, congratulations. Thank you for being as compliant as you were, and hopefully, albeit still limited, that little bit of a transition from being in the very hard lockdown into the lockdown environment that's experienced in Katherine. We trust that gives you a little bit of comfort and a bit of a ray of hope that good efforts and compliance can help us. The people in Binjari have just been exceptional in the last 24 hours with the engagement that's been undertaken. We've literally gone house to house. Many in the community have been deeply hurt by a lot of the social commentary, and they've put that out into the public domain, and I do pass on my thanks to them. It's an incredible testament of the efforts of our people and how professional they are, and all the resources that are there helping out both government, non-government and public who are coming forward and making donations and the like. It does make me incredibly proud as the Territory Controller to see that interplay and that feedback from the community that we are here to serve and protect. We know also that many in the community desperately want people to stay in the community. People want to quarantine on country, which is what we're facilitating. So again, you'll see a concerted and consistent effort to try and make it as comfortable as for people as we can. We've certainly put a lot more rigour around the boundary of Binjari, which we've done in consultation with community to make sure that we are keeping people there. It is in the best interests of the community residents of Binjari that people stay there, because we cannot have people continuing to leave that then puts the Binjari people into a further extended lockdown period, let alone the potential impact that has on Katherine. So we appreciate your support. You will see a lot of activity there to make sure that it's happening, and thank you to all of those who are actively monitoring for us as well. That's greatly appreciated. Robinson River has unfortunately just had quite the storm come through that impacted on our RFDS plane being able to land and take away some further tests, so we're a little bit delayed there, and our wastewater testing will be delayed a day as it relates to that as well. Telecommunications have been impacted. We're down to landlines, so the teams are going house to house again, engaging with the community just to give levels of reassurance and provide the negative test results that have been coming through. So that's very encouraging again, but just a further testament to the efforts that continue to go, and that irrespective of all of our best laid plans, Mother Nature always tends to have a little bit of a whip in her tail just to keep us on our toes. We've been adaptive throughout of this process, and it just continues, and the work, I keep saying it and I'll keep saying it, has been nothing short of exceptional. The efforts are continuing and we're making that difference. 40 people already have applied to return to Darwin and Alice Springs out of the Katherine lockdown zone who are bona fide permanent residents, so that system has now gone live. We're updating the website. We'll be facilitating the transfer for those. There's also some people in caravan parks that are bona fide interstate residents, and we're working on a methodology of how we may be able to facilitate your departure so you can return home as well safely, and through communication from our various checkpoints to the border checkpoint. My message to those caravanners, though, is please don't pack up your campsite and move on just yet. Follow our coronavirus website, follow the public information for when that process will come online. I'm hoping that'll be through the course of this afternoon, and then follow the movements directed from there in the application form. But we are cognisant of the fact that some of you have been isolating very, very well. We'll facilitate the testing arrangements, and upon that negative, hopefully be able to facilitate your safe departure from Katherine as well. We're critically conscious of making sure the public information continues. We'll keep doing that. That's the point of reference for all of you. So when you hear mischief, when you see mischief, please debunk it at first sight. Go to the sources of truth, which are your public information pages, certainly the local media that are present here today. They are the ones who will correct the record, and I'm very appreciative of that today. So where are we at? Well, lots of moving parts, lots of people doing some great things, but we're making a positive difference. Unfortunately, though, my resources have now been called to the community of Peppimenarti. We've had reports of shots being fired there this morning. There's significant unrest is being reported. I've surged additional police there. We're working with the health resources on the ground, and I understand also that West Daly have put out public messaging to indicate that they're suspending services on the ground. we'll work with all the key stakeholders as we respond to that incident. It is unfortunate there has been ongoing family disputes at Peppimenarti, and we really need people in these current times to understand there are far greater issues presenting to all of us, and we don't need to be caught up in these family fights and disputes. So please, everyone in Peppimenarti, take a breath, calm down, return home, let us establish order, and then we can help try to repair your community. Thank you.
While you're up there, I know it's sort of covered before, do you want to just run through the specific activities that are being undertaken by the ADO, what they're limited to down in the region?
They're limited predominantly to the transport of people who have difficulty being able to get access to testing and vaccination, so we're facilitating their transport. They're transporting close contacts to the airport for us to be able to move them to the Centre for National Resilience. Should add currently there's 255 close contacts in the Centre for National Resilience and 45 positive cases. So 300 people are in the facility from these communities that we've had to evacuate those people from, and that team are just doing an outstanding job in looking after those people and the care they're providing. They're also there to provide the food, drops and product support for the people in the lockdown areas, and they've been facilitating that. And then they're also facilitating assistance for us at the checkpoints.
These reports, these false reports about ADF and police forcibly vaccinating people, forcibly moving people from their homes, is that making your job more difficult on the ground at the moment?
Well, it is not necessary, I suppose, is the point I'd say about that. Unfortunately, public mischief and misinformation does create somewhat of a drain on my resources, particularly stories that, you know, people have up and left Binjari and they've ended up in all sorts of other remote communities. We have to exhaust a lot of energy to try and track down those things, and overnight we had to do that very task, several hours, to ultimately be able to extinguish rumour and innuendo, when really we could be far better off there making sure people are using the check-in app, you know, promoting better compliance and ensuring that people are being compliant with the direction. So it is distracting in the sense that it's unnecessary. However, we also know our source of truth, and again, just the feedback, and particularly from the health worker and the TOs of Binjari, to put those public statements out. Just thank you, because it's far better that the truth's out there, and it just is a testament to how strong our people are being out on the ground in challenging circumstances.
Have the 4 people who left Binjari with Katherine on Tuesday night received infringements?
So that work is still being undertaken. I haven't been advised that they've formally been issued those. We've gone through the close contact tracing interviews with them. The primacy was focusing on getting them into the Centre for National Resilience, which has occurred, and obviously the latest announcement of the exposure side is indicative of the outcome of the interviews. We'll get to the non-compliance in a reasonable period of time.
Just in terms of allowing people to quarantine on country, what measures exactly are being done to allow that to happen?
Well, I'm trusting that you're seeing the imagery that's being portrayed out into community. There is a significant movement of fresh food being delivered. There's articles being delivered. There's been a lot of donations. There's been care kits for youth there and children there. So again, soft drinks, fresh drink, like there's a multitude of efforts going in there, and if people need anything by house to house, we're engaging with them, and if it's a reasonable request, then we're able to facilitate that.
What is that? Oh, sorry. Oh, no, sorry. Just to clarify, do you mean close contacts moved to quarantine, or do you mean people in lockdown in general? No,
I mean complying with the lockdown. What we've certainly been doing is that those who are identified as close contacts, we've been removing to the Centre for National Resilience, and what we've ultimately found is that has proven very effective, because outside of the individual that left with 3 others the other night, she was the only one that had ultimately become positive outside of the Centre for National Resilience. All others have become positive whilst in there, which tells us our close contact methodology is certainly paying dividends.
So from today, Darwin residents who have been stuck in lockdown in Katherine can start to come home?
Those who are double vaxxed, those who receive a negative test in the preceding 3 days, who apply online and have a bona fide and confirmed permanent residence in Darwin or Alice Springs, if they tick all of those boxes, then we will facilitate their safe movement to their home, where they'll then undertake 7 days quarantine. They'll sign up to the G2G Now app, where they'll be obliged to meet with the check-ins that we do with them, as well as physical compliance checks from my police officers.
So if they've only had 1 vaccination, do they need to stay in Katherine
Correct.
until they've got their second?
Correct. And if there's any particular compassionate grounds or exceptional circumstances, then they just need to facilitate contact through our hotline, and we'll take that offline to have a look at that on its merits.
Do you have a number of how many people who've been unvaccinated who've been turned back or flown back to their originating port because trying to get into the territory since Monday?
Yeah, so my understanding is we've certainly done that with at least one. I haven't had any broader reports on it. It does appear that our messaging is being well received and people are being generally compliant with that direction.
So there's a woman in a caravan park in Katherine with 3 young children who's been locked down, but she's only got 1 vax.
Yep.
She has to stay there with her 3 children.
Currently she does. I'm aware of that case. That's been referred to me. I've asked our incident controller to have a look at that and establish what compassionate grounds may be in place there, and that'll be fed through ultimately into the Chief Health Officer to make a determination on whether the appropriate opportunity is to move them.
Dr. Payne, how close is Katherine to being taken out of lockdown and put into lockout instead?
Well, as the Chief Minister has said, we are obviously actively considering that. There are a few things, loose ends, to tie up before we move to that. So I wouldn't like to preempt that decision. Things could turn around. We've seen that happen. We're obviously looking at the wastewater. We're looking at the cases, see if there are any new cases. We've obviously had this exposure site, which is significant. We need to track down those people. But I suppose for Katherine residents watching this and thinking about what their situation is, a lockdown decision, a lockdown to lockout transition decision is imminent, but I wouldn't like to raise their hopes. Lockout, of course, will require significant restrictions. It will mean that people who are unvaccinated will not be able to leave other than for those 5 reasons. And so I suppose we would urge people to consider that and be prepared for that, that get vaccinated. Otherwise, there will still be some restrictions on those people. That is to protect the wider community.
Dr. Payne, how confident are you that you're now on top of this outbreak?
Yes, it's a good question. It's obviously very reassuring today that we only have 1 case. The surge of cases we had yesterday was expected because we were doing our day 5 testing. So the fact that this case is in quarantine already is a known close contact, and we haven't found any other cases that are unknown, no mystery cases, is very good. So I'd say first of all I'm very confident in our people and our system. And I'm confident that at this stage we're on top of it. It's unlikely, probably very unlikely, that we have community transmission in Katherine that we haven't detected. But I must ask the community again, please, we need your help with this, that if anyone has the slightest symptoms, they must come forward and get tested, please. If there's any transmission going on, that's the way we will pick it up. Our wastewater testing will help us as well. That's a sort of background surveillance, but we rely on people to come forward and get tested if they've got the slightest symptoms. Thank you.
We're in a situation where Darwin's not in lockdown, there's no restrictions here, but the hospital still has all these rules, especially in place for visitors who can't see their loved ones. Is that going to be the standard practice going forward in the event of any sort of outbreak? Well, when is that going to end for the hospital?
Yes. I can't speak directly for the hospital. They will make those decisions on the basis of their assessment of risk. But of course, I'm to some degree involved in that. In fact, the committee that considers those is meeting this afternoon. I can't promise that will lift anytime soon. There is this background risk. We're in a phase of risk where hospitals are very vulnerable, and we've had community transmission in the territory. So I'm afraid I can't give any more assurance about that at this stage.
South Australia opened its borders this week, and we've seen 2 cases, I think, there today. Is that our likelihood come the 20th of December when we effectively open house?
Is that sort of rate of cases likely? Yes. We were just discussing that today. So we're aware of those 2 cases, and we will be putting in some measures for South Australia. The risk at the moment is not great to us because if you have to declare at the border whether you've been in a hot zone. So So at the moment, there isn't a great risk of people coming across the border who haven't already been tested and aren't already double vaccinated. We will need to, though, put in place some measures to protect us from South Australians who might get infected from those cases that have come through. Of course, as we've seen with those 2 cases, they've been identified through the regime that's in place to protect South Australia, but we will need to put some measures in place in the next day or two to counter that risk.
And is it likely, just from the Northern Territory situation, over the next month, 2 months, as we open up our borders, is it likely that we will see outbreaks like that?
Yeah. Well, let's put it this way. We may well see cases. We hope we won't see outbreaks, because the measures we put in place should identify those cases and prevent those outbreaks occurring. But of course there is that risk, and our system will be tested over the next weeks and months, and we will have maximal responses to those outbreaks. We have, as you've seen with Katherine, we've got a very good system for contact tracing and so on. Those teams are highly skilled, and we've got capacity there. However, I'm very conscious in the role of the CHO that we can't continually expend their energy and resources. There are limits to this, and again, it brings me round to the appeal. We know from the Doherty modelling that we must get vaccination rates up to a level which will protect the community from, effectively give us significant herd immunity. So vaccination is our key. It's our way out of this.
The last figure I saw from Katherine was 77% double dose. Is there an update on that percentage?
It's a little bit higher than that. It might be 78%. Yeah, thanks.
And we know there's been a lift in vaccination since we've had this outbreak. Has that been widespread? Are those communities, say in Barkly and Central Australia, where we've seen those really low vaccination rates, are they actually starting to come up now?
Yes, that's good. Thank you. Good question. We are seeing still patchy uptake. There are still places in the territory where people clearly have formed a view collectively about this. It's extremely encouraging to see some of the rates coming up. So we're very much heading for 80% across the territory, but I have to say there are parts of the territory, I don't want to single them out. The evidence is there as to what those rates are. I don't want to single them out, but there are some communities that need to collectively make a decision. How are we going to deal with this issue? What is our response to this? There are a whole range of things they will need to do, and we will do our best for them, but they need to decide how they as a community are going to protect themselves. And our advice is very clear on that. We've given that over and over again, and we'd appeal to them to choose vaccination as their way of protecting themselves and protecting others.
Is the government doing anything to get this misinformation taken down on social media?
I believe there's been reaches out to Facebook that's happened in the past. I personally haven't pursued that with any line of vigour, if that makes sense. I've been asking the team how that's going in the past. We've not had any success in Facebook taking things down. So I'll double check that, but I'm pretty confident we would have asked those questions on Facebook, but I don't hold any hope. I've not found that they've ever taken it down.
Would you be calling on the Prime Minister to take further steps to regulate social media platforms and make them accountable for the sort of misinformation that's published on their websites?
I haven't been thinking about that this week, if that makes sense. Obviously, I made a few comments today about the misinformation, but I haven't been putting my brain into the policy space of online social media regulation. Obviously, we've been dealing with the outbreak, but I think a lot of us will acknowledge that there needs to be some conversation about how we handle what happens online. I mean, there's always been, I think, quite consistent public debate around that, around bullying or tragic youth suicides and others. Like there is a problem there. I think we're all aware of it. I know the federal government's done some stuff in that space in the past around the cyber commissioner or the e-commissioner, etc. But I do think more will need to be done. I wouldn't be able to give you an answer today. I'm sorry. It's not something I've been thinking about this week.
Is the government going to be offering more financial support to Katherine businesses?
Yeah, so we'll be doing a second round of the support. We've also got an ongoing conversation with the Treasurer, Josh Frydenberg, about a program we'll be doing together that's been running for a while, and we're looking at whether we can change some of the T's and C's around that for a second round of that as well. So that'll be territory-wide, recognising there has been impact on businesses across the Northern Territory during COVID. So there's a couple of things that we're working on, but specifically for Katherine, that second round will be out.
Have any extra resources been put into mental health support for residents in Katherine, and particularly Binjari and Rockall?
Yeah, so it's probably more expansive than that. So the welfare teams are on the ground talking directly to people one-on-one. So depending on what they need, we've been working out specifically with them. So it's broader than just a mental health conversation. That's there and that's available if people need it. But it goes to everything. It goes to power cards or food or stuff. So there's been that absolute conversation with everybody on the ground. The welfare teams are fully tasked and know, not just our welfare teams, obviously I read that huge list of NGOs that are out and involved who are helping us in all these areas as well. So there's a huge effort going into care, full stop, and that obviously includes mental health. Thanks everyone.